Coronavirus disease 2019 or COVID-19 is defined as illness caused by a novel coronavirus, now called Severe Acute Respiratory Syndrome, Coronavirus 2, SARS-CoV-2, formerly called 2019 nCoV, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province of China.
It was initially reported to the WHO on December 31, 2019. On January 30, 2020, the WHO declared the COVID-19 outbreak a global health emergency. On March 11, 2020, the WHO declared COVID-19 a global pandemic, its first such designation since declaring H1N1 influenza a pandemic in 2009.
Illness caused by severe acute respiratory syndrome or SARS-CoV-2 was recently termed as COVID-19 by the World Health Organization, derived from the acronym of Coronavirus Disease 2019. The name was chosen to avoid stigmatizing the virus origins in terms of geography, populations, or animal associations.
February 11, 2020, the Coronavirus Study Group of the International Committee on Taxonomy of Viruses issued a statement announcing an official designation for the novel virus, or the Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2.
According to CDC, the virus is thought to spread mainly from person to person. This means it may be spread between people who are in close contact with one another within 6 feet, or through respiratory droplets when an infected person coughs or sneezes. The droplets may land on the noses and mouths of people who are nearby.
Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. The CDC also reports that it may be possible for someone to get COVID-19 by touching a surface or an object with the virus in it, then touching their mouth, nose, and possibly their eyes. But this is not thought to be the main way the virus spreads.
The best way to prevent illness from COVID-19 is to avoid being exposed to the virus, as there is no vaccine to prevent COVID-19.
Wash your hands often with soap and water for at least 20 seconds, especially after being in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer or an alcohol with at least 60% solution.
Avoid close contact with people who are sick. Maintain physical distancing.
Wear a cloth face covering to cover your mouth and nose when around others, as physical distancing is not always possible.
Avoid touching your eyes, nose, and mouth with unwashed hands.
Stay at home if you are sick, except to get medical
Cover your
care.
nose and mouth with a tissue when coughing or sneezing. Throw the tissue away after use. If a tissue isn't available, cough or sneeze into your elbow or sleeve, not on your hands.
Clean and disinfect frequently touched surfaces. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfecting.
Wear a face mask if you are sick. Wear a face mask when you are around other people and before entering a healthcare provider's office.
All the frontliners, you are rising above panic and exhaustion. We thank you for risking your lives to protect our people. Indeed, you are true heroes of our nation, especially in this time of crisis. Thank you, frontliners.
Hashtag
Fight
Fight
COVID-19.
COVID-19.